when I had my first baby, one of the techniques I learned from an osteopathic physician was just to kind of like, in case the like baby has severe cold, just to make sure she doesn't get ear infection, is to just kind of gently pull on the earlobes. Very, very simple technique, but it actually worked for both my girls.
Yes.
Both my girls, even whenever they get ear infection, they've never been on antibiotics, and just that simple technique taught from an osteopathic physician really helps.
And it's beautiful.
It's wonderful.
That's what's called a modified Galbraith technique. It was developed by a doctor by the name of Galbraith. But the anatomy behind it is also very interesting. When kids are very small, the angle between the middle ear and the back of the throat where it drains is almost level. And so kids lying down with a bottle to go to sleep in a crib or on the floor, they tend to build up fluid in that area, and that tends to be a good receptacle for bacterial infection. And if the infection then produces inflammation of the eustachian tube where it's supposed to drain, then you get tissue reaction. You may block the eustachian tube, which causes a further reaction in that tissue and a worse infection. So the tradition of most pediatricians is to give an antibiotic. Well, if you functionally instead say, how can I remove that fluid that's there? So by you pulling on the ear, you put some tension on the ear and on the tissue that it's attached to, and it will help open up the eustachian tube and drain, therefore getting rid of the medium where the bacteria grows and stopping the infection. So there are two ways to get at it. One doesn't involve a drug, and if you get at it early, you as a mother may be able to take care of that at home instead of having to go into the physician and have it taken care of. So it works wonderfully.
It's amazing. Yeah, and my girls have never had antibiotics for cold or ear infections. It's amazing.
Wonderful.